Okay, first off, let's tackle the basics. Diverticulosis versus diverticulitis. It's like two sides of the same coin, but one is just a little angrier. Understanding these two conditions is essential for recognizing how they can affect your health. Diverticulosis is when you have small pouches called diverticula popping out in your colon. Picture them like little potholes forming in your digestive highway. They're usually harmless and don't cause any symptoms, which is why most people don't even know they have it. It's like one of those silent guests you don't realize is at the party. In fact, about 50% of people over 60 have diverticulosis, and many go through life without a clue that their colon is playing host to these little pouches. But diverticulitis, that's when things get heated. Imagine one of those potholes suddenly inflaming or getting infected. Ouch. When this happens, you may start to notice some serious symptoms. These can include fever, severe abdominal pain, typically felt on the lower left side, and changes in bowel habits like constipation or diarrhea. It's not just a minor inconvenience, it's a wake up call that your colon is in distress. So, yeah, diverticulitis is the messy guest who shows up, throws a tantrum, and ruins your colon's party, potentially leading to complications if not treated promptly. So imagine your colon is like a long muscular tube that helps move waste through your digestive system. Over time, especially as we age, pressure can build up inside this tube. This pressure may be caused by a low fiber diet, constipation, or simply the normal wear and tear on your digestive system. When there isn't enough fiber to keep things moving smoothly, your colon has to work harder, squeezing tighter and creating pockets of high pressure. It's kind of like pushing too hard on a balloon. Eventually, weak spots pop out. These weak spots are where the walls of your colon bulge out, forming small sac-like pouches, diverticula. They're like little outpouchings along the colon wall, almost like tiny balloons or potholes. Over time, as more pressure builds, these diverticula can form in clusters, especially in the lower part of your colon, like the sigmoid colon. This is how diverticulosis begins. Now, if those pouches become inflamed or infected, diverticulitis, it's a different ballgame. Treatment depends on the severity of the symptoms. Mild cases of diverticulitis can often be managed at home with rest, antibiotics, and a temporary low-fiber diet. Reducing fiber for a short period gives the colon time to heal by easing the pressure on it. If the pain is more severe, or if there are signs of complications like abscesses, your doctor might recommend hospitalization for stronger antibiotics or even intravenous fluids. In rare cases, when there's a risk of serious complications such as a tear or blockage in the colon, surgery might be necessary to remove the affected portion of the colon.